Okay, looks like everyone's on the webinar. Let me get started. My name is Dr. Hashimoto. Today we're going to be talking about male health. We're going to be talking about how you could regain your life with a full erection. It's not just a macho thing anymore. It's really, a source for happiness. It's a source for pain, and it's doing this without a magic pill. So I'm going to teach you this by revealing our new regenerative medicine treatment that will enhance any erection in size and firmness. So this is myself, Dr. Hashimoto, and this is my partner, Dr. Olesnicki, and together we're Desert Medical Care. We're a regenerative medicine clinic in the Coachella Valley, and we've been offering stem cells and regenerative medicine for many conditions. Dr. O has been passionate about stem cell therapy since the early 90s, wherein he actually studied it in grad school in Columbia. So this information is for you if you can achieve an erection but require the aid of Viagra, Cialis, Levitra, or injections. This information is for you if you can achieve an erection but lack the firmness for penetration. And that's a very common one that we treat. This information is for you if you can achieve an erection but lack the stamina to satisfy yourself or your partner. And that's a big one. A lot of times you may feel dissatisfied, but your partner is equally, if not more, dissatisfied. And if this is something that progresses for a long time, we've seen cases where it actually starts to affect the marriage. And that's the last thing that you want when your partner starts to wander around. This information is for you if you have no erection problems, but just simply want to add girth or length or overall sensitivity to your penis. This information is for you if you want to combat the effects of inevitable age. Today, you're going to discover what causes 70% of erectile dysfunction, a possible solution to ED by medication side effects or surgical trauma. You will also discover what you could do today to combat the effects of age on your sexual health. So why is this information important to you? Well, most doctors do not really understand the benefits of regenerative medicine for sexual health. A lot of doctors out there, especially in my age bracket, will just tell you to accept it as an age problem or a post-surgical problem just to deal with it. Most do not address the neurological or dietary causes of ED. I think testosterone is great for urges, but it doesn't do a lot for overall performance. So I have a disclaimer to make. We do not have a 100% cure rate when we do our regenerative procedure. For the people that we do accept into our program, we have about an 80% success rate. We don't take everyone on as a patient, and we also offer a guarantee. Our guarantee is that if you're unsatisfied with the outcomes of the procedure, we'll repeat it at no charge within the first 3 months of that procedure. So I don't see anyone else out here doing that, and the reason why we do that is that we do screen our patients, and we know who's a good candidate for this and who's not a good candidate for this. So if you're not a good candidate, unfortunately, we're just not going to take you on as a patient. So let's go over some of the causes of ED. So endocrine disorders such as diabetes, pituitary tumor, etc., abuse of medication and drugs, psychological, which isn't as big of a factor as some people think. Smoking contributes to it, so if you are smoking, we suggest that you quit smoking because it's good for your overall health. Neurological causes from alcohol abuse, diabetes again, multiple sclerosis, Parkinson's, radiation therapy, or spinal trauma. And then you have the cardiovascular issues in over 60% of the cases. So we have our 5 pillars for treating ED, which are the following. First, obviously, we got to get a baseline measure. If we're not measuring, then we don't know if you're improving. We also have to improve circulation and make some dietary changes. A lot of people underestimate the power of diet. We also look at offering the appropriate regenerative medicine procedure to improve the vascularity of the penis, and rehabilitation when appropriate, addressing structure when appropriate, addressing nerves when appropriate, and medical supplementation is last. So let's look at some of the stats in science. About 80% of the cases of ED go unreported. 30 million men suffer from this right now in the country, and by the year 2025, they say it's probably going to be closer towards 322 million. There's very little research on this, and it's just something that a lot of men are embarrassed to talk about. When people come into our office, we're very discreet. Basically, you just set up an office visit and then discuss it privately with the doctor, or when you call on the phone, just say that you need an ED appointment or a male health appointment. And the staff will bring you back, and this is something that really isn't televised to the public. So let's look at some of the medications out there. You got the Viagra, Cialis, Levitra. Basically, you have the phosphodiesterase 5 inhibitors, PDE5. They're going to last anywhere from 4 to 17 hours, depending on the medication. Cialis is going to last on the longer side, Viagra on the shorter side. Side effects are going to be flushing, headaches, gastrointestinal issues. It's not safe for anyone that's had a recent heart attack or a stroke or unstable angina. We do prescribe these to some of our patients. It's always a case-by-case basis. There's injectable medications like Caverjex and Eject. Basically, it's an injection that can be done prior to sexual activity, or some of these can be done just twice a week. Probably, well, they're not really the most pleasant things to do before intercourse. So, when we get our baseline on the first pillar, the first thing we do is we give you a questionnaire, which is a little bit more in depth than this. But basically, we want to know about your confidence to get it up and keep it up. When you have sexual stimulation, how often were they hard enough for penetration? During intercourse, how often were you able to maintain that erection? And then how difficult was it to maintain it? And then when you attempted sexual intercourse, how often was it satisfactory for you or even your partner? So how do we improve circulation? Now, the first thing we look at is diet. Now, this will never fix your issue, but it always does help. And then we look at ways to improve circulation. There's a lot of different supplements out there, and I'm pretty sure you've read up on some of these. You got the L-arginine. I personally like giving 1 to 15 grams per day. Omega-3s are really good for reducing plaque. Antioxidants, which do come from a lot of vegetables, will help prolong the amount of nitric oxide from the L-arginine to last in your system. They also help with the elasticity of the vessels. And then you also have niacin, which is a B vitamin, which is good for the vessels. So a lot of people really overlook this, and then I find that there's a lot of supplements on the market that just really oversell what they have to offer. And then you have the various herbal supplements out there in the market. Some are for adapting to stress, like ashwagandha and rhodiola. You got saw palmetto, which is good for male health. You got the Tungat Ali, which is a sex hormone binding goblin. Tribulus, which is good for testosterone. So, you know, the horny goat weed, which helps with arousal. So, there's limited research on these. They do help to a certain degree. We've had patients that swear by them. So, you know, we just have you keep taking them if you prefer to do that. One of the main things that we do is a regenerative medicine procedure, which we will go into detail. In the news, it's called the P shot, also known as a Priapus shot. You know, you could read about it on Men's Health and various other magazines and GQ and things like that. There's been a number of people that have had this procedure done. It's a very simple procedure where we take your blood, spin it down in a centrifuge, and get the growth factors after we've spun it down. It's been used for decades as far as orthopedics go in your joints. It's been used for things like the vampire facelift because it offers a regenerative effect on the joints and also on the face, and it can actually be done on the penis. And I'll go into this procedure in detail here in a second. So that is with platelet rich protein coming from your blood. We also offer amniotic fluid, placenta, and umbilical cord therapy. The amniotic layer is the innermost layer of the placenta, and it's immunoprivileged, which means it does not contain any proteins to cause any adverse immune reaction. This is a very safe product. It goes through a 9-step process by the FDA that is a very rigorous sterilization process. I've actually had this injected into myself for joint and tendon and ligament issues. My partner's had it injected into his joints. put it into our spouses, put it into our parents, put it into uncles and stuff like that. So it's a very safe product that we stand behind. The companies that we buy these from are very large, publicly traded companies that make these products. Essentially what happens is you're going to have a woman that goes to the hospital that signs a waiver saying that she's going to donate her birth organs. So it's going to be the placenta, the fluid that surrounds the baby, and the umbilical cord. It's screened and tested, and then it's sterilized, and then it's sold to clinics like ours. And then we will actually deploy this in the penis to help with erections. We also do stem cell deployments. So why would you do a stem cell? Now a stem cell is a cell that you started out in life as. A long time ago, your mom and dad got together and they donated 23 chromosomes each, and that made you. That tiny cell grew into your hair, your liver, your lungs, your kidneys, your pancreas, and your organs, and your penis. And a stem cell will have a regenerative effect. Stem cell is just going to really help you heal. If you think about a dying plant, the way that most people treat it is they're just trying to cover up the symptoms. When it comes to a pain medication, they're trying to block it. If you're taking things like Viagra and Cialis, you're temporarily increasing the blood pressure, releasing nitric oxide, and it's going to help with that erection for that day, but it's not going to help it long term. Plus, Cialis is extraordinarily expensive to take long term. So if you have a dying plant, we know that it needs certain things. You don't just cover up the symptoms. We make the plant healthier, and the plant will need sunshine, water, and good healthy soil. So the pea shot is going to do that. So it's a very painless and regenerative procedure. It was invented by Dr. Charles Hormonal. The PRP is injected into the corpus cavernosa, which is this area right over here. There's no major nerves or arteries to hit in this area. And then we're going to inject 6 shots into the penis. 2 in the base, 2 in the middle, 2 in the tip. And it's going to result in a firmer, larger, more frequent, longer lasting erection. It's going to last up to 18 months to 24 months. It's going to move you up the erection scale. So if you're 81 years old, it's not going to make you 18 years old, but it's going to move you towards probably 40 years old. It's either going to eliminate the need for Viagra, Cialis, or Levitra, or it's severely going to reduce that. And then it's going to increase the tissue, and you can actually increase size in specific spots. So if we have some men that have like a curved penis and they just want to work on the other side, we're going to inject a little bit more on the other side to balance it out. So it just straightens it out a little bit better. And then if we do a stem cell procedure and amniotic fluid, it's the same procedure, just a different injectable. We'll also integrate low-intensity shockwave therapy. There's a plethora of research out there on this. You're going to have positive response in 60 to 70% of the patients. It's great for patients with vascular issues. It supports angiogenesis, which is a fancy word for the development of new vessels, and it stimulates the production of nitric oxide synthase, which is how you get an erection. The fourth thing that we will look at, which is not an issue with a lot of the people, but with some, is structural issues secondary to ED. So some patients may have ED symptoms related to a spinal problem. So if you have a chronic lower back issue, this could contribute to your ED. If you have a weak pelvic floor muscle, this will also contribute to your ED over here. Pelvic floor is underneath here, and it's the foundation for the erection right here. And if you have a strong pelvic floor, it's going to help keep blood in the penis and prevent it from escaping, like over here. So some patients, like I said, will have a weak pelvic floor, and Kegels are the best way to work on this. And the key with Kegels is to do them in different positions. So a lot of people are more familiar with this with women after childbirth, but men could do these as well. It's a very easy exercise to learn how to do. Once you learn how to do it, you'll be able to do it for perpetuity. So the easiest way to learn how to do it that I teach patients is that you can sit on the toilet if you want, to prevent any spills, but you sit down, you urinate, stop for 5 seconds, urinate again, stop for 5 seconds, urinate again, and just do that. And you do that for 2 or 3 days, and that muscle that you're using to stop the urination is actually this pelvic floor muscle, which is going to be between the base of the penis and the anus over here. Now, when I say fire this in different positions, we want you to be able to fire this laying down flat on your back with your knees bent, sitting down, standing, walking. And if you could do this in various other positions without making a funny face, then you've learned how to fire your Kegels. In fact, I'm doing them right now. Fifth pillar, medical supplementation. So we're going to look at things like testosterone. Testosterone can be delivered through an injectable pellet that stays there for about 3 or 4 months. Weekly injections of testosterone, creams of testosterone, gels of testosterone, and we'll also look at things like human growth hormone. We'll also look at things like Levitra, Viagra, Cialis, and other erectile dysfunction medications. It's not uncommon for us to prescribe Cialis as part of our procedure, just kind of for that first few months to kind of get that erection really going. Another thing that we'll always recommend with our procedures is a mechanical device. These are very safe. A medical grade unit is going to be about $200 or more. It's not going to be a $20 to $40 junky thing that you're going to find on Amazon made in China. The ones that we recommend to our patients aren't the cheapest, but they actually work. Cylinder is going to be placed over the penis. It's going to have a vacuum pump attached, and then you're going to pump in some negative pressure. We recommend staying under 10 psi, and that's probably going to get you your best results. Over here in the picture, it talks about a tension ring. You're not going to be doing that. You're just going to be pumping this up for 10 minutes, and we have you do this for about 10 minutes a day for the first 6 weeks. And think of it as yoga for the penis. So we put in regenerative cells, and if you want your penis to actually thicken up, you're going to pump this in so the tissues can actually start expanding. So those regenerative cells are going to thicken up that corpus cavernosum, so you have a thicker, larger penis. Case studies. Now, we've done some younger males, but our typical patient's going to be a 55 plus. We're in the desert, so obviously we have a lot in their late 60s and 70s, and these are the people that are usually suffering from moderate to severe erectile dysfunction. We have our first one over here, 76-year-old male suffering from ED after prostate surgery. That's a very typical patient that comes into our office. One procedure, he was good within probably 2 months. And then another typical patient is going to be your cardiovascular patient on diabetic medications and hypertension, starting to develop this. We do place a heavy emphasis on diet when it comes to those types of patients. So how do you turn today's information into a better sexual life? Now you understand why treating ED is complex and why we offer a 4-step system. We get a baseline first, look at the regenerative medicine, look at improving the circulation and cardiovascular health, improve the structural support and neurological issues related with ED. We do medical supplementation. Before I tell you who this procedure is not or who it's for, let me tell you who it's not for. It's not for someone that has zero ability to achieve even a partial erection because of a neurological trauma. This won't work for you. It's not for someone who's already thrown in the towel in their sex life. It's not for someone that's only interested in services covered by their insurance. It's not for someone that doesn't care about the effects on their partner. This procedure is for people that really want a change. As far as costs go, basically what we're doing since you've attended the webinar, it's you're going to come in and you're going to get a complete evaluation. We'll review your medications, and we'll actually give you a penile pump, and that is a very high grade one. If you look it up online, they're about $200 to $250 retail. So it's a medical grade penile pump, and then we give this with you on your procedure, and you're going to get that on your evaluation. So that's basically a $250 value right there, so you're getting your visit for free. As far as guarantees go, this is not going to work for 100% of you. For the people that we do take on as a patient, it's going to work on 80%. 20% of you aren't going to get the big change that you want. So, and if you don't get the change that you're looking for, we'll repeat that procedure at no cost within 3 months. Usually that repeat would be between weeks 8 and 12 because oftentimes it takes at least 8 weeks to see a change. So we won't repeat it before then. So that's our personal guarantee. As far as starting, you could click below. There's a link where you could schedule a free phone consultation. We'll go over all that, and I'll answer any questions for you. And if it seems like a good fit, then the next step would be to come in for an evaluation. And then if it still seems like a good fit, then we could go forward with a procedure, and we'll let you know which procedure we recommend and what the costs are. This is Dr. Hashimoto signing off. Look forward to talking to you soon.